Hello and welcome. Thank you for joining me. My name is Rebecca Preza and I am the Healthcare Facilitator at UCSB. In this video, I will provide a high-level overview of the open enrollment changes for retirees for the 2022 plan year. Open enrollment begins October 28th at 8 a.m. Pacific Time and closes on Friday, November 19th at 5 p.m. Pacific Time. Please make sure all your open enrollment changes are completed before the end of the open enrollment period. Please note, this open enrollment is a few days shorter than previous years. Please keep this in mind as you prepare and plan for open enrollment. Good news. All health plans and health plan administrators will continue in 2022 with minimal changes. Let's review some frequently asked questions. If I like what I have, do I have to do anything during the open enrollment period? The answer to the question is no. If you are happy with your enrollment, you do not have to make any changes during the open enrollment period. All current changes will transition over automatically to the 2022 plan year. When do open enrollment changes become effective? All open enrollment changes become effective January 1st, 2022. How do I enroll or change my medical, dental, or legal plans? To make changes during open enrollment, you want to sign in or register on UC Raise. You can also contact the Retirement Administration Service Center, RASC, at 1-800-888-8267 for assistance. As mentioned before, all non-Medicare plans and Medicare plans will remain the same in 2022. Please keep in mind that if you switch Medicare plans, you must also remember to complete the appropriate U-Ben form and return to RASC. Partner plans for split families will also remain the same. Again, please keep in mind that if you switch partner plans, your Medicare-eligible family members must also complete the appropriate U-Ben form and return to RASC. Let's take a look at the medical plan changes for the UC Blue and Gold HMO plan. Members will be able to obtain a 2-week supply of high-cost, high-adverse effect medication at a $0 copay to determine tolerance of high-cost therapy. This applies to oral anti-cancer medications in 2022. This has the potential to save members money and reduce drug waste. Additionally, there will be a generic drug substitution policy change. In 2021, medically necessary brand drugs currently pay at the Tier 2 or Tier 3 level. In 2022, medically necessary brand drugs will pay out at the Tier 3 level, whereas non-medically necessary brand drugs will no longer be covered in 2022. Flu shots for adults and children can now be obtained at office visit or Health Net contracted pharmacy at a $0 copay and no upfront cost or need to file a claim. Other adult immunizations can also be obtained at an office visit or Health Net contracted pharmacy at a $0 copay and no upfront cost or need to file a claim. Please keep in mind that this only applies to adult immunizations. This change does not apply to children's vaccines. Kaiser changes for our non-Medicare and Medicare plans are the same. The following changes apply to members enrolled in Kaiser HMO or Kaiser Senior Advantage. The Kaiser HMO and Kaiser Senior Advantage plans will now cover medically necessary dental exams and treatment prior to any organ transplant. This change is retro as of January 1st, 2021. In addition, home medical visits, also known as house calls from a PCP or specialist, will change from a $0 copay to align with the cost share based on the visit type. The 2022 Anthem Changes will apply to both the non-Medicare and Medicare plans. The following changes apply for members enrolled in UC Care PPO, Health Savings Plan, Core, UC Medicare PPO, and the High Option Supplement Plan. As of January 1st, 2022, Navitus will replace IngenuRx as the pharmacy benefits manager. Navitus customer care is available to answer questions, find participating pharmacies, and review drug formulary. Please note there is a number for non-Medicare members and one for Medicare members. Keep this in mind when you reach out to the Navitus team for assistance. Learn to Live will replace My Strength in 2022. Anthem will be sending out more communication in the coming weeks to assist you in this transition. Under the Health Savings Plan, the 2022 Irs Maximum Contribution for the health savings account for an individual will increase to $3,650 and $7,300 for a family. The $1,000 catch-up contribution will be available for each member and each family member who are at least 55 years old. The core plan design will remain the same for 2022 with the exception of the replacement of the new pharmacy benefits manager, Navitus. Upcoming changes for the UC Medicare Choice Plan are as follows. Renew Active will replace Silver Sneakers starting January 1st, 2022. The telehealth services have been expanded and will now include Teladoc. Finally, United Healthcare has expanded their discount program to include theme park tickets, travel, fitness equipment, home improvement, pet insurance, financial services, and more. The 2022 Medicare Part D CMS mandates for the true out-of-pocket, TROOP, will increase to $7,050 in 2022. This change applies to all Medicare plans, UC Medicare PPO, UC High Option Supplement, Kaiser Senior Advantage, and UC Medicare Choice. There are also incremental changes in the low-income subsidy for groups 2, 3, and 4 in 2022. The 2022 advertised rates we will visit in the next few slides applies to retirees who are eligible for 100% of the UC contribution toward retiree health. If you are subject to graduated eligibility, your cost may be higher than those presented. You can view your 2022 cost in UC Raise starting October 28th. Here are the 2022 costs for retirees who are eligible for the maximum UC contribution and when all family members are in Medicare. These are the 2022 costs for retirees eligible for the maximum UC contribution and when one or more family member is not Medicare eligible. Finally, these are the 2022 costs for non-Medicare and non-Medicare plans age 65 and over who are not Medicare eligible. Again, these rates are for retirees who are eligible for the maximum UC contribution. If you are subject to graduated eligibility, you can view your rates via UC Raise starting October 28th. There are no rate or benefit changes to the Delta Dental PPO and Delta Care USA HMO plans. If you are subject to graduated eligibility, you will continue to pay a share of the cost for these plans. VSP continues as a vision provider for retirees. As a reminder, this plan is voluntary as a retiree. To enroll, please contact VSP directly. The primary eye care program will become a permanent benefit starting January 1st. This program provides supplemental medical eye care services, including eye injury trauma, foreign body removal, diagnosis and treatment of eye conditions, including pink eye, vision loss, and cataracts. RIG legal rates remain the same with a few enhancements. The plan has expanded alimony and child support modifications, child support enforcement, annual accounting for guardianship or conservatorship, restraining orders, and general support hours increase from 4 to 6 per year. For additional information regarding all open enrollment updates and changes, please visit the Open Enrollment website on UCNet. You can also contact the Healthcare Facilitator Program or our Emeriti Retiree Center Coordinator with any additional questions. Thank you for watching.